Thank you for joining us for today's presentation, The Art of Giving Directions at Rapid City Regional Hospital. One of our core values is that we are always striving to continually exceed the expectation of every patient and customer in regard to service, effort, and professional standards. As part of those efforts, we have identified the need to enhance the wayfinding system at Rapid City Regional Hospital. Recently, we have brought in a consultant to review, develop, and implement a plan to enhance the patient experience as it relates to navigating our facility. These enhancements have included new directionals and informational signage, touchscreen directory units, and other collateral materials. One of the most important elements of any successful healthcare wayfinding system is our interaction with our patient and visitors. And this is the reason we are here to learn the art of giving direction at Rapid City Regional. Let's take a moment and put ourselves in our patient and visitors' shoes as they have come to our facility. We have to assume that most of them have never been here before. They did not wake up this morning and decide that today would be a great day to go to the hospital, but are here due to serious illnesses that they or a loved one may be going through. So they are under quite a bit of stress and in a strange, unfamiliar environment. They are confronted with confusing medical terms such as otolaryngology and an alphabet soup of initials such as CICU, MICU, SICU, HIM, and so much more. They may have a variety of physical issues that impact how they navigate the hospital, including visual acuity, age, language differences. All of these issues added together can and in most cases will result in a confused, frustrated person that is in a building and is negative impression on our facility. That negative perception could have a great impact on customer satisfaction and HCAHPS scores, patient throughput when one patient is late that can cause a backup that could continue to impact patients hours later, facility branding and the perceived image of the hospital, employee and physician recruitment, and all of these combine to affect the efficiency and profitability of our facility. When you come across a lost patient and or visitor in our facility, this is a golden opportunity to show them that they are in the caring environment and that they are our primary concern. By providing proper instructions prior to their visit to our facility, we have begun the process of making them more comfortable with navigating our facilities by giving them the information to park in the correct area, utilize the correct entrance, and the process they need to follow up on check-in. When you take a few moments to learn the 4 W's of your patient and or visitor, you are better prepared to serve them. Know who they are so that you can evaluate and determine the level of assistance needed. Know what they are there for. Know where they need to go. Know when they need to be there. Use the tools that are available to help you make them more comfortable. These tools are broken up into 2 areas of use: prior to visit and at site. Prior to visit, provide them with verbal assurance to help make them more comfortable. Use this opportunity to guide them to the proper entrance that they need to go to by giving them items to identify where they are. Remember to guide them to the resources available on the hospital's website, including the new video that provides guidance for the visit. Let them know that when they get onto the site that the following resources are available: easy to read signage that has been developed to help provide reassurance that they are on the right path to their destination. Valets and staff and volunteers at the information desk are there to assist them to provide guidance and resources. The patient and visitor guide and maps are available that show the major destinations at the facility and how to get to them. Touch directories located in the Fairmont, West, and emergency lobbies that provide animated instructions on how to reach their destinations. The backbone of our wayfinding program is a process called progressive disclosure. By using consistent and simple instructions, we can guide our patients and visitors to their destinations using the various elements of the wayfinding system to reinforce their paths. Remember that there are hallways that cannot be utilized due to secured doors or ones that you do not want them using. So they need to be guided using single, predetermined pathways that are meant for public use. It may not be the shortest route, but there are the most reliable route that they can access. To keep it simple by incorporating limited cues and landmarks to guide the patient and visitor through the facility. These cues include elevator names, addresses, distances, and specific destination points. Remember to evaluate the situation and determine if you need to escort the patient to their destination as the best way to care for the patient and/or visitor. Also, if you feel like you cannot provide the needed guidance for any reason, please ask for assistance from the nearest information desk or a fellow employee to ensure that they receive the care they need. Leaving them to fend for themselves will not leave a good impression on your facility. By taking the time to ensure that our patients and visitors are able to navigate to our facility, we will show that care is in our hearts for them and that we are here to serve them. Remember that it is our privilege to care for patients, their families, and visitors. One expression of the compassion is to enhance their experience while they are here.